esteemed committee members, welcome to this special briefing for our course, The Theories and Practice of Fitness Assessment and Exercise Prescription. This is a 3-credit elective course offered in the spring semester, and I'm honored to co-teach it alongside Dr. Inigo Mujica. In this 20-minute video presentation, I will unpack our systematic course design. Furthermore, we will showcase the specific optimized EMI scaffolding techniques used in our class to lower students' cognitive burden while maintaining high-quality professional learning. Let us first examine the core competencies and goals that driven this curriculum. The core educational objective of this course is to systematically train students in assessing human fitness and designing tailored, evidence-based exercise prescription. This knowledge directly connects to 3 key professional competencies outlined by the Department of Biomedical Engineering. The core educational objective of this course is to systematically train students in assessing human fitness and designing tailored, evidence-based exercise prescription. This knowledge directly connects to 3 key professional competencies outlined by the Department of Biomedical Engineering. First, interdisciplinary teamwork. Through structured problem-based learning modules, which account for 30% of their final grade, students work in teams of 4 to 5. They simulate clinical consulting, debate physiological metrics, and reach professional consensus of custom prescriptions. Second, global vision and social responsibility. By utilizing a fully English media instructional model, students reach and cite cutting-edge international guidelines. In our final week, we focus especially on vulnerable population or specific population, so teaching students how to address the physical health need of those target population. Third, biomedical engineering professional skills and self-growth. This course takes the raw physical data measured by biomedical sensors and translates it into real-world physiological intervention. It teaches students to evaluate cardiopulmonary, muscular, and metabolic health, developing self-directed clinical reasoning skills that ensure they continue growing as professionals. Let us now look at how this is mapped across our 16 weeks timeline. To ensure medical level safety and rigorous clinical logic, our 16-week curriculum is scaffolded into 3 distinct phases. Phase 1, span weeks 1 to 7, titled Foundation Screening and Basic Assessment. Before a single exercise is prescribed, students must establish absolute safety. They learn the pre-participation health screenings, understand cardiac and metabolic risk factors, and master health-related fitness measurement, such as cardiorespiratory body composition and range of motion. This established their scientific data baseline. Phase 2 covers week 8 to 13. Core exercise prescription designing. Now that they have baseline data, we teach them how to apply the international FIT-TVT principles, named frequency, intensity, time, type of exercise, volume, and progression. The design target protocols for cardiorespiratory, endurance, muscular fitness for upper, lower, and core muscular and flexibility training. Phase 3 covers weeks 14 to 16. Specialized and clinical rehabilitation application. This is the apex of the course. Students apply their skills to the target population, especially older people, female athlete, and the clinical population with a chronic illness. Crucially, in week 16, they tackle clinical evaluation and athletic conditioning for return to sport after musculoskeletal injury, bridging biological recovery with active performance. Let us examine how our classroom hours are structured to facilitate this complex learning. To achieve a robust learning by doing environment, our instructional methods are highly diversified. As shown in the left column, only 40% of our time is spent on traditional lectures. The remaining 60% of those time are active learning. So we have 20% of time doing group discussion, 20% actual clinical case study analysis, and 20% is for hands-on laboratory physical testing and coaching. This instructional diversion ensures students immediately apply those theories to real practice environment. On the right, we outline our dual support network that secures students' learning. First, we provide a dedicated laboratory teaching assistant for all practical testing sections. High-intensity cardiorespiratory and maximal strength testing carries inherent physical risk. Having a clinical TA allows for close monitoring, manual correction of biometric sensors placement, and zero compromise safety standards. Second, we integrate professional industrial speakers. Every semester, we invite practicing physical therapists, athletic trainers, and biomedical rehabilitation product managers to present. They teach our students how physiological data is leveraged commercially, bridging schools' concept with the professional career options. Let us look next at how we handle our EMI challenges.
Okay, after discussing the physical demands of esports athletes, we will now introduce some common injuries. Although esports do not involve intense physical like traditional sports, prolonged gaming, repetitive movement, and long period of sitting can still lead to various health problems. This injury can generally be divided into three categories: musculoskeletal injuries, visual problems, and psychological and physiological issues. The first category is musculoskeletal injuries, which are the most common injury among e-sport athletes. In the upper extremities, prolonged mouse and keyboard use may lead to carpal tunnel syndrome and tendinitis. Carpal tunnel syndrome occurs when the median nerve in the wrist is compressed, while tendinitis results from repetitive hand and forearm movement. In addition, maintaining the same sitting posture for long periods can cause neck and shoulder pain as well as lower back pain. The second category is visual problem. E-sport athletes spend many hours looking at screen every day, which can lead to digital eye strain. Common symptoms include dry eyes, burnt vision, and headache. In several cases, it may reduce concentration and negatively affect gaming performance. The final category is psychological and physiological issues. E-sport competitions are highly competitive, and players often face performance pressure, intensity training schedule, and irregular sleep patterns. As a result, they may experience anxiety, poor sleep quality, and mood problems. These issues can affect both physical and mental health and may ultimately reduce competition performance.
Okay, so next I'm going to talking about the training plan and the prioritization for e-sport players using League of Legends as my example. And many people think e-sport players only sit and play game, but professional players train for many hours every day, and they need focus, reaction speed, decision making, and stable performance. Because they sit for a long time and repeat keyboard and mouse movement, they may have a shoulder, wrist, neck, and lower back problem. So the goal of the plan is to help players reduce fatigue and prevent injury and perform consistently. And this slide shows the annual League of Legends schedule. As you can see, there are many competitions from January to November, and the player need to be ready to fight every time. And only the December is the off season. And because the schedule change, the training plan should be also change, and players should not train with the same intensity all year. And this slide shows the most famous player faker daily routine. And a player day include sleep, meal, screen, solo queue, streaming, and free time. And even through they don't run every game and then spend a lot of time sitting and using the mouse and keyboard. And League of Legends also require quick reaction and decision making. So when players are tired, their performance may be unstable. And this is why my plan focuses on 4 parts like the strength, cardio, and hand-eye coordination and flexibility. And this is the in-season training plan for stage 1 and stage 2. During the season, the goal is not heavy training. The goal is to maintain performance and reduce fatigue. And players do strength training twice a week and cardio once a week. Monday is strength A, focus on push movement and core. And Wednesday is the 10, 20, 30 cardio interval. Friday is strength B, focus on pull movement and core. And other days are for the strengthening like the flexibility, hand-eye coordination, recovery, or rest. And here are the main exercises. Strength A include the bench press, squat or leg press, shoulder press, dead bug, and external rotation. And the exercise builds strength and protect the shoulder. And strength including the desk pull down, deadlift or hip thrust, row bank, and face pull. And this exercise helps improve posture and reduce the shoulder and back discomfort. And the cardio part using the 10-second fast, 20-second moderate, and 30 seconds easy. Repeat for several rounds. And next is the tournament peak phase, including the NSI Cup, Asian Game Cup, and the World Cup is the most important competition. And at this stage, the goal is not to improve blood. The goal is to stay fresh and avoid soreness. Training volume is reduced. Players do the light strength maintenance, light cardio, and strengthening recovery. Keep the player ready, but don't make them tired. And during the tournament peak, exercises are lighter. For example, player can do goblet squats, light bench press, desk pull down, and external rotation and plank. And this movement can help maintain strength but not cause heavy fatigue. And the last part is the off season, mainly in the December. And this is the best time to build physical foundation because there are no dance competition, and players can train more during this part. And they do strength training, cardio, interval, flexibility, and or the outdoor activity like swimming, hiking, or easy running. And the off-season plan follow an 8-week progression, like the first adaptation, then base building, strengthening, and peak week, and finally recovery and testing. And the purpose is not to make e-sport player train like the traditional athletes. This is to help them stay healthy, and reduce fatigue, and perform better for a longer career.
First, let's look at the physical aspect. Good physical fitness helps e-sport players reduce injury risk, such as overuse injury in the wrist, shoulder, and neck. It also improves posture and operational stability. Core muscle and lower limb endurance help maintain stability during long game section. Next, the mental aspect. Physical fitness and regular exercise enhance focusing and reduce fatigue, helping players maintain high efficiency during long competition or training session. Third, the competitive aspect. Good physical fitness improves reaction speed and hand-eye coordination, enhancing operational stability and directly improving competitive performance. Finally, hardware and software integration. Proper hardware such as ergonomic chairs, keyboards, and mice provides comfortable support. Combined with software management, including sleep management, mental training, and physical training, these scientifically enhance overall play's performance. And thank you everyone, it's our presentation. This is our work assignment.
Okay, and many people believe that the esports only requires technical gaming skills, and however, the professional players often train for more than 6 to 10 hours per day, and prolonged sitting can lead to discomfort in the neck, shoulders, wrists, and lower back, while also negatively affects concentration and reaction time. So therefore, muscular training can enhance cognitive endurance and sustained attention, whereas strength training can improve postural stability and reduce the risk of muscular injuries. These figures demonstrate that the sport is not a low-demand activity. During the competition, players can reach heart rate of 120 to 180 BPM and engaging substantial physiological stress. Prolonged concentration also increases cognitive fatigue, while repetitive movement and prolonged sitting contribute to the musculoskeletal problems. So studies report that 42% of players experience a musculoskeletal pain and 66% have sustained related injuries, which may ultimately reduce the performance and career longevity. And this figure highlights the importance of cardiovascular training for sport athletes. Moderate aerobic exercise helps regulate heart rate and improve breathing control and maintain substance attention, while HIIT can effectively enhance cardiovascular fitness in the shorter time. As shown in the activation curve, an optimal level of physiological exertion is associated with peak cognitive performance. So therefore, this cardio training can improve not only physical fitness but also reaction time and decision-making ability. And this figure summarizes the key benefits of cardiovascular training for sport athletes. Regular aerobic exercise can be shown to enhance cognitive endurance, improve reaction time and decision-making, increase cerebral blood flow, and reduce the physiological stress. Practical training methods include running, cycling, and rolling for approximately 30 to 45 minutes per section, and helping players maintain focus and optimize competitive performance. This figure says that the primary goal of the strength training for sport activity is not muscle hypertrophy, but postural stability. Prolonged training often leads to wrong shoulders, forward head posture, and lower back compensation. Therefore, training should focus on core, back, and shoulders muscles. Exercise such as core stabilization, rolling movement, and scapular control and improve postures, reduce injury risks, and support sustained gaming performance. This study shows the effect of an 8-week physical training program on professional leg or leg players. After competing, 2 strength training sessions and 1 hour training section per week. And this finding just suggests that regular physical training can effectively enhance both health and competitive performance in sport athletes. This table compares the players' fatigue and performance before and after the intervention program. Following the 8-week physical training program, both physical and cognitive fatigue will significantly reduce. And this finding suggests that physical training benefits not only physical fitness but also cognitive function and competitive performance in sport athletes. This study compares the effect of 12 weeks or upper limb strength training combined with ergonomic intervention versus static training alone in young sport players. And this finding suggests that combining strength training with ergonomic adjustment is more effective than static training alone for reducing discomfort in the shoulders, arms, and wrists among sport athletes. And this figure presents the functional performance outcomes after 12-week implementation. The quick DASH scores decreased significantly in the strength training group, indicating reduced upper limb discomfort and improved functional ability. In addition, the grip strength increased for approximately 95 to 105 pounds, demonstrating substantial gains in upper limb strength. Although both groups showed improvement in posture assessment, the strength training groups achieved greater overall benefits, suggesting that the strength training combined with ergonomic intervention is more effective for enhanced upper limb function and posture.
哦，好粗哦，二头肌爆出来了。
可以 ，OK。
研究你现在大概多少？好，你要说几下？
抽到好嘞。
上肢吗？我帮你放一下，有个上肢，我等下帮你做下肢。我还没找到我拉皮。